First aid and emergency safety measures.
Step 1. Check for consciousness. Grasp the victim by the shoulders and shout, "Sir, sir, are you okay?" Repeat 2 times. If he does not respond, check his pulse and check his underneck and untie the button if he wear polo. Roll him onto his back after making sure that he has no spinal injury. If he has spinal injury, gently roll his head, neck, and shoulders together as a unit until he is on his back. Step number 2. Open the airway. Check for breathing. See if the victim's chest and abdomen are moving. Listen and feel for air moving out of the mouth. If the victim is not breathing, open the airway. Turn the head to one side and clear any foreign material from the mouth with your fingers. Place one hand on the victim's forehead and tilt the head back gently. Place the fingers of your hand under the chin and lift to pull it forward. Sometimes, just opening the airway will allow the victim to breathe. Keep the airway open and look, listen, and feel for signs of breathing. If the victim still does not breathe, begin rescue breathing immediately.
Step 3. Begin rescue breathing.
1. Check for the pulse. Pinch the victim's nostrils shut with your thumb and forefinger. With your other hand, continue tilting the chin forward to keep the airway open. 2. Take a deep breath and place your mouth over the victims, making a tight seal. For an infant, place your mouth over the mouth and nose. 3. Blow air slowly until the victim's chest rises. Take 1/2 to 2 seconds to give each breath. Remove your mouth from the victims and take a deep breath between rescue breath. Allow the victim's chest to fall and feel the air escape. 4. Give 2 full breaths, then check for circulation.
Step 4. Check for circulation.
Check the circulation. Locate the carotid artery in the neck. Find the voice box or Adam's apple. Feel for a pulse for 5 to 10 seconds. If there's no pulse, begin chest compression. Give rescue breath.
Step 5. Begin chest compression.
Kneel next to the victim, check the child for consciousness. If no response, call 911 immediately. Check for breathing and signs of life for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand to the center of the child's chest. Place your other hand on the top with your elbows locked and arms straight. Lean over the child's chest and compress the chest 2 inches. Then, compress 15 to 30 times. After the compression, quickly do the head tilt, chin lift, and give 2 slow, gentle breaths. Again, check for breathing and signs of life. No breathing or signs of life. Repeat the 15 compression, 2 breath cycle, and check the pulse again. If there is no pulse, continue rescue breathing and chest compression until help arrives, or the victim's pulse and breathing return.
Rescue breathing for adult. Check for unresponsive. And position of the victim. Open the airway and check for breathlessness. Give 2 full breaths. Check your pulse. Call the EMS for help.
Briefing, has a pulse, call 117.
Now begin rescue breathing. Recheck pulse. And continue rescue breathing. Other important common first aid safety measures.
Fainting. Fainting during the Victorian times was considered feminine and a sign of aristocratic good breeding. Today, fainting is a signal that something is wrong inside the body. It can be a sign of danger to the heart or brain, a panic attack, hyperventilation, malnutrition, or even pregnancy or menopause. Warning signs to faint. First, sudden paleness of the face, cold, clammy skin, dizziness and nausea fingers, numbness or tingling, sudden rapid or weak pulse, feeling of panic and blurred vision. Treatment. The step-by-step guide for maintaining the medical safety when a person fainted are first, lay the person down on the floor on his back. Practice your ABC of first aid. Make sure that the airways are clear, that the person is breathing, and that the blood is circulating. Loosen clothing if necessary to make sure that the victim is comfortable and able to breathe clearly. Open windows when inside a building to allow air to circulate. Keep chin up to prevent the victim's tongue from obstructing the throat. If the victim remains unconscious or conscious but groggy, disoriented, and nauseated, it is best to call for medical help. The least you need to know. Fainting in and of itself is not usually an emergency condition, but it is a signal of an underlying problem, and it can create its own set of problems. Be aware of fainting signs such as a clammy skin, dizziness, a pale face, and nausea. Follow the 5 minutes rule. If a person remains unconscious for more than 5 minutes, get help. Do not use smelling salts to revive someone. Place the fainted person in a prone position. Loosen his or her clothes and open nearby windows.
And lastly,
Make sure the person's airways are clear, breathing is regular, and circulation is normal.
So today, we are going to talk about something very important, and that is how to treat a burn. So what is a burn? A burn is caused by dry heat. It's either from a fire or an iron. A scald on the other hand, is caused by something wet. It could be either from a steam or a hot water. So a burn is characterized into different degrees. It could be either first, second, or third, depending on how deeply or severely they penetrate into the skin. So these are the steps to follow when performing a first aid with a person that has a burn. So first thing, you have to immediately get the person out of the heat source to stop the burning. So second step, we have to cool down the burn by putting it in a running water for 20 minutes. You have to put this for 20 minutes in a running water and make sure do not use any grease like butter to the burn. So third step, remove any piece of jewelry near the burn site. So just like this one, you have to remove this. So any piece of cloth or jewelry that's near the burn site, we have to remove it. However, we do not touch any jewelry or piece of cloth that is stuck into the burn. So after performing everything, washing the burn for 20 minutes, for cooling it down and removing any piece of jewelry or cloth, next step is to cover the burn with a piece of cling film. So we have to get a piece of cling film, just enough to cover the burn, the area. A clean plastic will also be good. It will also do the same job. So that's it. So if the face or the eyes are burnt, make sure that you do not lie down. As much as possible, stand up because this will help reduce the swelling. You could also use painkillers, over-the-counter medicines like paracetamol or ibuprofen to help relieve the pain. And lastly, if it's an acid or chemical burn, seek medical help immediately. So when to seek medical help? Depending on how serious a burn is, it might be possible to treat at home. But for minor burns, we should always keep in mind to clean the burnt area and do not pop any blisters that form. For more serious type of burns, it may be second degree burn or third degree that already affects not just the first layer of the skin or the epidermis, but also the lower layer of the dermis, which goes down deeper into the tissues. So those are the things that we have to remember so that we are knowledgeable enough to deal with different kinds of situations.
That's all. Maraming salamat.